thank you so much to the Institute and to the initiative for having me here. I'm delighted to represent Horizon Blue Cross and Blue Shield of New Jersey. You heard a little bit about Horizon and our 3.8 million members, our 85 years of history, more than 85, working proudly in all the communities of New Jersey, as Jonathan shared earlier. And I hope that we're working in all those 6 conditions that Christina just spoke about. We're going to be talking today a little bit about big data and how big data can be used to improve pediatric health. So I thought we could start with the end in mind. This was taken this past Saturday. We came here to the Rutgers, Michigan game, and it was a really impressive first quarter. We had a lot of fun, but these are my 2 girls, and I thought this is one vision of pediatric health. And here's some data about the 2 kids. They're about 15 and 10. They get, on average, between 8 to 12 hours of sleep a night. They're different ages. They both play 2 sports throughout the year. We've had no injuries. They have a 100% attendance record at school. This means they're not getting sick. Both kids have had maybe 1 or 2 doses, rounds of antibiotics in their life. They have positive socialization. They're doing good with their BMI. One has a chronic condition, but it's really well managed, never been to the emergency room. One had a birth defect, again, very well managed. We do have 1 to 2 pizza meals a week. They're kids, but they eat a lot of whole grains and healthy food. So I thought as a parent, as a consumer, that this is a pretty good picture of health, and we're very fortunate. We learned this morning that there's a term for this, and it's called positive health. So this is a vision of positive health, and we want to use big data to get this kind of outcome in every community in New Jersey. So that's a tall order. So being kind of innovative and thinking like a TED Talk, here's our evolution of cell phones. So you might remember some of those big car phones back in the era. Motorola had these big, huge devices, right? Do you remember the far left? The far right looks even slicker than what we see here. But the explosion of data and the devices that we're using is incredible. So why do I bring this up? Care delivery is now wearables. Wearables promote a lot of data. This is big data that we can harness. Personalized medicine, we've touched on this a little bit today. Care advisors using all this technology and artificial intelligence. Remote monitoring. Could we have our kids getting on scales and then a care manager's reaching out in the morning if something was going awry? And then something like virtual reality. Could we have a guided reality view of a birthing room or a treatment room for a child to minimize anxiety before they get into that clinical setting? So there's a lot of data coming from these devices, and we want to harness this data in a positive way to improve pediatric health, although it was fun to look back at what the phones had looked like. So we know there's an explosion of data. It's just beyond belief. Big data does bring big responsibilities. I think entities like Facebook have learned about this. So 4.2 million likes on Facebook in a minute, and this is a few years old. To about 2 million posts on Instagram. I bring this up for all of us as consumers, but our children are in this space. So they are generating this data. They're Snapchatting, they're Instagramming. right? Even today, we're on Twitter for this really amazing event. So this big data, it's super exciting, but we can use it. I have friends who post on Facebook, they're in the emergency room with their child who broke their arm or their leg or what. I kind of marvel, why are you sharing your protected health information on social media? But could you not use that for an intervention to improve a healthcare experience or outcome? Also, recipes. A lot of recipes, I notice, are shared on social media. Some are healthy, some are not. We'll probably get a lot of recipes about turkey in the next week. So there's certainly an explosion of data, and big data in healthcare is moving to the cloud. The cloud, I like to think of the cloud, has to rain, and it rains data into this data lake. So the data lake for a company like Blue Cross would have claims data. This is very traditional for us. Clinical data would be very, very important at Rutgers-Barnabas Health System. Pharmacy data, different kinds of logs and treatment notes. But we want to bring in also the social data, the healthy apps that we all have, the genomic data. All of this is coming into the lake. And this is very exciting. Sometimes it's overwhelming to think of all the kinds of data that are out there. Consumer data, I thought you would find fascinating. We go to the supermarket, you get the coupons that print out. They are tailored to your shopping patterns. That means someone is watching what you're buying. We now have variables that we can use that the household used their credit card at a fast food experience. So I call this a French fry variable. But I think that this is really fascinating. Someone said to me, well, I think if I have to go to fast food, I'm paying cash. But that's not the right answer. We want to harness this data in the lake for positive health outcomes. Remind everyone, be friends with your technical, your IT people. If you're going into the data lake and big data, this is the technology landscape. The picture just like this from even a couple years ago was probably half this page. So look at all these vendors and technologies serving in the health big data arena. It is beyond. So this is what's getting harnessed to do some of the amazing studies and research that everyone's talking about. At Horizon, we're more in, we're certainly working collaboratively, the great work of our foundation, working with Rutgers, but we do a lot of we're practitioners working in the community piloting. And this is the kind of data complexity that we deal with just to do a small initiative around community health workers or really anything, closing gaps in care. So we have a data warehouse, you have electronic medical records, disease registries, immunization registries are so important for our state and for our children. All of this needs to come together just to do one analysis. So we really want to take action. It's not enough to describe what's been going on the left, the descriptive analytics, to have good hypotheses. We talked about this earlier today. We are moving into predictive, do a lot of predictive studies, what's going to happen next, and we want to almost suggest the next best action to take. These kinds of analyses and studies, the learnings, can be put right back in the workflow. They're not good if they're in the analyst's laptop. They're best when deployed right into the clinical workflow. Not easy to do, but that's our objective, really, to take action on all the information. And one of the things that's become increasingly clear is of all the factors that contribute to health outcomes, health insurance, we made our box blue, but it's Horizon and all the health insurance carriers. We're just one factor. So we talk so much about biological factors today, the health status, social support. These are all super important. The family function. Are you having, how many family meals are we having at home? Environmental factors. These are all crucial variables for our children's health. And this learning came to us from the Kaiser Family Foundation. So here's a few pediatric examples I thought I'd share with you. This first one looks at total spend. The blue line is women, the orange line is men, over someone's lifetime. So you can see in the first year of life, there's a spike up. There's a lot of spend in the first year of life. Then it comes down because hopefully children, what we're all working towards is healthy children. They don't incur a lot of medical cost. And then we see the run up in the middle age, and then in terms of total spend for Horizon, even going out into age 100. So this is fascinating, really, to look at the whole picture, the whole dynamic of a big population, 3.8 million members. When we focus in on our kids, this really threw me. So I made it a little bit easier to digest for today's purpose. But think of a population of 1,000 kids. And this is Horizon data. Most in New Jersey, and this is in our value-based programs, our ACOs, our medical homes, most of those kids have asthma. Look at childhood diabetes. And then there's our friend, obesity. So asthma, we haven't spoken as much about asthma, but in our urban communities, the ability to breathe well for our children is also so crucial. Here's a look at emergency room visits. So if we're being managed well, we're not as much in the emergency room for kids. We know all the reasons why. These are our pediatric medical homes. They have an established relationship with their pediatric patient. This is a wide array of utilization of emergency room visits from 350 per thousand down into the 50s, and we're looking at the size of the practice. So some of the practices have 12,000 patients. These are huge pediatric practices, right? This is quite an array here. But our goal is to make sure our children have access to health care, that they're with their pediatric practitioner, and things are being well managed. So those are some real examples of how we're using troves of data, right? We've heard 3.8 million members every time a claim comes in. Now every time someone's posting on Facebook. We have these disruptive technologies. We have different kinds of clinical needs at Horizon. We have different kinds of innovations in payment reform. So it's just an era of rapid innovation. The big data is helping us optimize care so we can be smarter and work together, feed those alerts right into the electronic medical records. We want to show that quality saves, and big data can be an important enabler. So in terms of the future of healthcare, where we've been, just like those phones, is a lot of medical product innovation and consumables. Now we're in that kind of wearable era. And next, we're really moving into artificial intelligence. This is the data and the machines are really thinking and suggesting for us. So it's a very exciting time to be using data And we really want to do that to, as you all have shared, improve the health of our children here in New Jersey. So hopefully we have our vision of positive health in the end. Thank you.